Initially, it was just a strange sensation, as if your legs had lost a bit of their spirit. No pain, no ache, just not as nimble as before. Sometimes you'd stumble slightly when turning around suddenly. Other times you'd stand up and feel a bit dizzy, needing to grab the nearest chair. Nobody thought much of it. It's just age, right? Doesn't everyone get that way? But then, at some point, people realize their feet are colder than usual, or they completely lose sensation when stepping on cold tile floors in the morning, or it takes a few minutes for blood to return after massaging. This isn't just about age anymore, it's about stagnation, about tiny blood vessels weakening day by day. This seemingly small issue can be the beginning of much bigger things, from losing balance while walking to the risk of slow healing wounds, even leg ulcers in old age. But the good news is you don't have to wait for complications to act, because blood flow can absolutely be guided back if you know how. And that way, sometimes it just starts with the right vitamin at the right time. Many people, even healthy ones, often think that weak, cold, or numb legs are normal after age 60. They assume it's due to tired muscles, poor gait, or simply aging blood vessels, nothing to be done. But that's a mistake. In reality, blood circulation to the legs and feet doesn't naturally decline. It's affected by factors that we can adjust, especially a deficiency in certain essential vitamins for blood vessel walls, for blood vessel dilation function, and even for the nervous system that controls blood flow. And the surprising thing is, there are very familiar vitamins found right in your kitchen or pharmacy that have been shown to increase blood flow to the legs by up to 45% in just 1 hour. Today's video will help you discover exactly what those vitamins are, how they work, who should use them, and how to use them safely and effectively. Let's start with the first group, the vitamin that can open the way for blood flow in just 30 minutes. The name may be simple, but the effect is anything but subtle. Niacin, also known as vitamin B3, is one of the few vitamins that can produce a noticeable biological effect in less than an hour, and that sensation starts right in your feet. Imagine an older person waking up early in the morning, stepping out of bed, but the first sensation isn't alertness, it's a chill penetrating from the soles of their feet all the way to their heels. It's not due to cold tiles, not due to drafts, but because blood isn't reaching the extremities. At that moment, the legs feel like two constricted pipes, a tingling sensation, heavy steps as if weighed down by lead. And if that sounds familiar, then it's time to re-examine the role of vitamin B3 in blood circulation to the legs. Vitamin B3, specifically the flush niacin form, has a special ability to dilate the peripheral capillary system. The mechanism is very clear. When niacin enters the body, it activates ENOS, endothelial nitric oxide synthase, and also promotes the release of prostaglandin D2 and E2, two mediators that help blood vessel walls relax, allowing blood to easily flood areas like the feet, lower legs, and peripheral tissues. This effect isn't just theoretical. A clinical trial published on PubMed Central, conducted with a group of people equal 60 years old, recorded that after just 1 hour of taking 500 milligrams of fast-release niacin, blood flow to the skin of the legs increased by almost 45% compared to the placebo group, measured by laser Doppler. More importantly, participants clearly described a spreading sensation of warm feet, as if blood had found its way back to their often cold feet. So niacin can be a calm key. But how do you use it to unlock the right benefits without causing inconvenience? Because niacin's characteristic reaction is the flush phenomenon, meaning redness, burning, and even slight itching all over the body, especially on the face, chest, and arms. For those unfamiliar, this sensation can cause alarm, leading them to think it's an allergic reaction. But in fact, this reaction is not dangerous and is a sign that niacin is working correctly to dilate blood vessels. However, to use niacin safely, effectively, and comfortably, a reasonable regimen is needed. Here's the recommended approach. Start gently, 100 milligrams every morning after a meal with a glass of warm water, about 200 milliliters. Monitor your reaction. If the warm flush is mild and not overly uncomfortable, you can gradually increase to 250 milligrams, and after a few days, 500 milligrams a day if necessary. Do not take on an empty stomach. This is especially important as niacin on an empty stomach tends to cause a stronger reaction. Take with good fats. Consuming it with foods rich in healthy fats like avocado, salmon, or a few almonds will help with better absorption and reduce the flushing sensation. Another simple tip, take niacin on cold days or before going for a walk. Many older adults report that taking niacin 30 to 60 minutes beforehand helps their feet feel warmer, reduces the stinging cold sensation when going outside, and makes it easier to move. However, there are also cases where caution is needed. If you are taking high-dose statins, drugs that treat high blood fat, taking additional niacin may increase the risk of liver damage or muscle pain. Individuals with chronic liver disease, elevated liver enzymes, or those being treated for stomach ulcers should also consult a doctor before taking high doses of niacin. Additionally, in some people, niacin can cause a slight drop in blood pressure, especially if taken with antihypertensive medications. Therefore, for those closely monitoring their blood pressure, it's necessary to measure blood pressure regularly during the first week of use. Nevertheless, when used correctly and at appropriate doses, niacin can bring many benefits beyond increasing leg circulation, lowers bad cholesterol, LDL, and increases good cholesterol, HDL, helps improve the elasticity of small blood vessels, and for older adults, most importantly, helps keep legs warm, flexible, and less tired, something often overlooked in typical supplement programs. You might wonder, why not use non-flush niacin, meaning niacinamide? The answer is, that form does not have the vasodilating effect. Therefore, if the goal is to increase blood flow to the legs, only the flush form of niacin is effective. In summary, niacin is not a miracle pill, but in the peripheral vascular care system, it is an active link and one of the few options that can provide an almost immediate sensation. If your feet are frequently cold, or it takes you more than 15 minutes to warm up your legs each morning, then very likely niacin is what's missing. And once the path has been opened by niacin, the next important step is to keep that path clear long term. That's when a familiar vitamin is needed, one that can both protect blood vessels and support dilation persistently, vitamin C. Let's continue the journey. Vitamin C is not just an immune booster during cold seasons, not just present in your morning orange juice. Vitamin C also acts as a rhythm keeper for the peripheral circulatory system, especially the small blood vessels supplying the legs and feet. The story begins with a molecule called BH4, tetrahydrobiopterin. It sounds complex, but let's imagine BH4 as a coordinator that helps the body produce nitric oxide, NO, which is the substance that directly causes blood vessels to dilate, allowing blood to flow more easily. As people age, especially after 60, BH4 is easily destroyed by free radicals, oxidative stress, leading to a decline in NO production. The result is that blood vessels don't dilate as before, blood flow to the legs decreases, and from that, a series of familiar uncomfortable sensations appear: coldness, weak legs, and fatigue after walking short distances. And this is where vitamin C steps in. It has the ability to regenerate BH4 while also neutralizing free radicals, helping the body maintain the necessary amount of NO to keep blood vessels soft and clear. A study published on PubMed showed impressive efficacy. After just 2 hours of taking 1,000 milligrams of vitamin C, peripheral vascular function was completely restored in older adults with signs of circulatory impairment. This means that with just a single dose, the ability to dilate blood vessels, which had been reduced due to age, was revived almost immediately. But this doesn't mean you have to take a lot. The recommended dosage is 500 by 1,000 milligrams a day, divided into 1 to 2 doses, preferably after breakfast or about 30 minutes before walking. For those with sensitive stomachs, it's best to divide the dose and take it with food. A simple but effective tip: In the morning, instead of just drinking coffee, add a glass of diluted lemon water or a glass of warm water with half an orange and a few slices of kiwi. This not only helps supplement natural vitamin C, but also supports hydration, which is very important for leg circulation. Another method adopted by many older adults in the US is to use sugar-free, effervescent tablets or chewable vitamin C, which are easily absorbed and don't cause blood sugar spikes, especially suitable for pre-diabetics. However, using vitamin C also requires a few considerations. Do not exceed 1,000 millimoles a day, especially for those with a history of oxalate kidney stones, as a small portion of vitamin C can be converted into oxalate in the body. Drink more water, at least 1 glass of water with each dose, to dilute the concentration and reduce stomach lining irritation. If you are taking antihypertensive or diuretic medications, inform your doctor to ensure appropriate dosage. Additionally, vitamin C has a rare advantage: its synergistic effect with other vitamins, especially when used with vitamin E. Its antioxidant capacity will be significantly increased. These two vitamins work as a duo. Vitamin E protects cell membranes, while vitamin C regenerates vitamin E after it's oxidized, thereby keeping blood vessels stronger and more elastic. And if you pay attention, you'll notice an interesting phenomenon. Older adults with diets rich in vitamin C often bruise less, experience less coldness in their hands and feet, and have fewer nighttime leg cramps. It's not because they're taking special medication, but because their blood vessels are healthy, thanks to being nourished and protected correctly. In the journey of caring for your legs after age 60, vitamin C is like a quiet friend, always there when you need it. When you need to walk more lightly, experience less numbness, and avoid risks like leg ulcers due to poor blood supply, vitamin C plays that silent protective role. And now, with blood flow opened by niacin and its rhythm maintained by vitamin C, it's time to soften the small blood vessels and increase microvascular elasticity, a task that requires an even stronger antioxidant capable of penetrating deep into cell layers and significantly reducing blood vessel stiffness, vitamin E. If someone has ever experienced a slight prickling sensation in their toes when waking up, or unexpected leg cramps in the middle of the night, they'll understand one thing: the problem isn't always with the muscles. In many cases, the cause comes from the small blood vessels themselves, gradually losing elasticity over time. And that's where vitamin E, especially the natural form, dietocopherol, can play an incredibly important role. This isn't the first vitamin usually mentioned when talking about blood circulation, but for older adults, vitamin E is like a lubricant for the microcirculatory system, helping blood flow smoothly through every delicate capillary under the feet. Have you ever heard of lipid peroxidation? That's an oxidation process that damages the fat layer in cell membranes, the membrane surrounding every blood vessel. When this fat layer is damaged, blood vessel endothelial cells lose their flexibility, causing blood vessels to become stiff, constricted, and less able to carry blood. This is especially dangerous in peripheral areas like ankles, soles, and toes, where blood vessels are already small and often subject to cold and body weight pressure. Vitamin E acts as a powerful antioxidant, helping to prevent this peroxidation process. It protects the cell membrane from being destroyed by free radicals, while also keeping the blood vessel lumen soft, flexible, and able to expand enough for blood to pass through easily. As a result, the blood supply to the feet is not interrupted, and sensations of numbness, coldness, or sharp pain during activity gradually improve. A study published in Oxford Academic clearly showed this. In people aged 65 and older, supplementing with 400 IU of vitamin E daily for 4 weeks not only increased measurable blood flow velocity at the ankle, but also significantly reduced the vasospasms experienced by patients with Raynaud's phenomenon, a syndrome that causes severe coldness in the extremities. This demonstrates that vitamin E can truly improve quality of life by delivering blood deeper into the coldest and farthest regions from the heart, such as the heels and toes. So, how can you supplement vitamin E correctly and effectively? First, it's important to know that vitamin E is fat soluble, If you take it on an empty stomach, your body will absorb it very poorly. But if you take 200-400 IU after a meal that contains healthy fats, for example, breakfast with an egg, a slice of avocado, or a spoonful of olive oil, the absorption will be optimized. You can imagine a familiar scene. A light breakfast consisting of whole grain toast, a few slices of tomato, a soft-boiled egg, and a glass of almond milk, followed by a tiny vitamin E capsule. It's simple, gentle, and fits well with the eating habits of many older Americans. But before you start taking vitamin E, ask yourself, are you currently taking blood thinners like warfarin? If so, your vitamin E dose should not exceed 800 IU day. This is because vitamin E, just like omega-3s, can prolong blood clotting time, and if combined incorrectly, it can increase the risk of bleeding under the skin or prolonged bruising. Additionally, if you're already taking vitamin C, congratulations. These two vitamins complement each other perfectly. When vitamin E neutralizes free radicals, it gets oxidized and loses its effect, but vitamin C will quickly regenerate vitamin E, allowing it to continue its mission of protecting blood vessels. This is why many experts recommend taking E and C together, a double insurance for your peripheral vascular system. Another interesting point, vitamin E doesn't have a flushing effect like niacin. There's no facial redness, no sudden warmth. Instead, it has a persistent and subtle effect, much like regularly oiling an old machine. It helps the gears run smoothly without any squeaking. And if you're wondering, how long will it take to see results? With a dose of 200-400 IU day, most older adults can start to feel their feet less cold in the early morning, fewer leg cramps when lying down for long periods, and sometimes a feeling of greater flexibility when getting out of bed, typically after about 3 to 4 weeks of consistent use. You can try a self-test, stand on one leg while brushing your teeth in the morning, or gently rotate your ankles for 2 minutes before bed. If you find these movements less painful and more comfortable after a few weeks of taking vitamin E, your body might truly be thanking you. However, the story doesn't end there. No matter how well you fight rust, if the bloodstream carries too much homocysteine, your blood vessels will still gradually stiffen. So, to lower the levels of this substance, as well as protect the myelin sheath of the nerves that control leg blood vessels, we'll need a special duo, folate, vitamin B9, and vitamin B12, and that will be the next destination on today's journey. When your feet start to feel like ants are crawling on them, or a cold sensation spreads from your heels up to your calves, even when it's not chilly, it's very likely that the problem isn't just slow blood circulation, but also related to how your body processes a seemingly harmless substance, homocysteine. Homocysteine is an intermediate amino acid present in the blood. Normally, it's quickly converted into harmless substances thanks to two important factors, folate, vitamin B9, and vitamin B12. But if you're deficient in one or both, homocysteine levels will rise, and this is not good for the circulatory system, especially the small blood vessels in your legs. High homocysteine levels cause blood vessel walls to lose elasticity, increasing the risk of mild chronic inflammation and reducing the body's ability to produce nitric oxide, NO, an important substance that helps blood vessels dilate naturally. What's the result? Blood can't flow easily to your feet, creating the heavy, stiff, and cold sensation that many older adults often attribute to age. But the truth is that this condition can be partially reversed if we supplement enough vitamin B9 and vitamin B12 in the appropriate forms. A noteworthy study published on PubMed showed that when people over 70 with high homocysteine levels were supplemented daily with 5 milligrams of folic acid plus 500 UG of methyl B12 for 6 weeks, homocysteine levels dropped by 23%, and blood flow to the calf muscles increased by an average of about 28%, not 2 to 3%, but nearly a third, a number that can make a big difference in daily walking ability. The interesting point is, vitamin B9 and B12 don't just affect blood vessels. Vitamin B12 also plays a role in protecting the myelin sheath, the insulating layer of nerve fibers. When this layer is damaged, the nerves that control blood vessel dilation also function less effectively, leading to sensations of coldness without vasoconstriction, or numbness without compression. Therefore, supplementing B12 helps restore sensation and improve circulatory reflexes, especially in people with signs of sensory disturbances in their legs. Now let's talk about practical usage. If you haven't had your blood vitamin B12 levels checked, it's best to prioritize using methylfolate and methyl B12 forms, as these are highly biologically active and easily absorbed, especially in older adults with reduced absorption capacity. The starting dose is usually 400-800 UG of folate plus 250 UG of B12 daily, taken after breakfast. For cases where high homocysteine levels have been confirmed, or there are signs of B12 deficiency, fatigue, forgetfulness, mild leg itching at night, a doctor may prescribe a higher dose, up to 5 milligrams of folic acid plus 500 gg of B12 day, usually for 4 to 6 weeks for adjustment. A small tip to increase effectiveness: after taking folate and B12 in the morning, perform some simple exercises like rotating your ankles, doing calf raises, or walking in place for 2 to 3 minutes. These movements help activate the mechanical pump, pushing blood down to your feet more easily. Combining them with nutrition will help improve circulation quickly and noticeably. However, there's a crucial point to note. Do not supplement high-dose folate if you're not sure you're not deficient in vitamin B12. Because when you're B12 deficient and take a lot of folate, some neurological symptoms can be masked, leading to silent nerve damage progression. Therefore, if you or a loved one has a history of macrocytic anemia, are a long-term vegetarian, or use long-term stomach acid suppressants like omeprazole, have your B12 checked before starting a high-dose regimen. Additionally, people with severe kidney disease should be cautious when taking high doses of folate, as elimination may be slowed. In these cases, a low maintenance dose, 400-600 UG day, and regular monitoring will be safer. If you want to get these vitamins through food, there are several natural options rich in folate, like spinach, broccoli, asparagus, and lentils. As for B12, it's only found in animal-derived foods, typically chicken liver, eggs, milk, and salmon. However, older adults often have poor absorption from food, so using supplements is a worthwhile consideration, and also easier to control the dosage. A suggestion for a suitable breakfast: a slice of whole grain toast with nut butter, accompanied by poached or soft-boiled eggs, and a small mixed green salad, followed by your folate plus B12 capsule. This combination is not only convenient but also helps make supplementation a habit that's easy to maintain. So how long will it take to see results? Unlike niacin, which creates a warm flush in just 30 minutes, or vitamin C, which improves vasodilation in 2 hours, the effect of B9-B12 is a kind of underground recovery. Users typically feel the most noticeable changes after about 2 to 4 weeks, with signs like less cold feet when sitting for long periods, fewer sudden nighttime spasms, and a feeling of more stable steps. Especially if you have a habit of cold feet when sleeping, this could be the first clear sign of improvement. And finally, if you already have a plan to supplement B3, niacin, vitamin C, and E as covered in the previous sections, then adding the B9-B12 duo is like installing a smart piping system, not only ensuring good circulation, but also maintaining a stable and healthy state long term. In summary, if we compare vitamin B3 to a blood flow accelerator, vitamin C to a bridge that keeps blood flowing uninterrupted, and vitamin E to a lubricant that keeps vessels smooth, then B9-B12 are the silent engineers who adjust pressure and stabilize the entire system. So after a long journey, we've explored 4 types of vitamins, or rather 4 companions, that are silently supporting every light step of older adults each day. From niacin, the first vitamin that brings a warm sensation under the skin within 30 to 60 minutes of taking it, as if a valve has just opened, rushing blood to the tiniest capillaries in your toes. That warm sensation, even if fleeting, is clear proof that your body still has the ability to recover, if you know how to awaken it. Then comes vitamin C, without a noticeable outward effect like flushing, but silently repairing the blood vessel lining, the place that determines whether blood can glide smoothly all the way to your feet. With just one pill each morning, not only is the heavy leg sensation improved, but it's also a gift to your entire circulatory system. Vitamin E, like a protective oil coating for blood vessels, keeping them from rusting over time. That elasticity, though hard to feel immediately in every step, is what helps your legs feel less tired when standing for long periods, less stiff when the weather changes, and less likely to be startled by a nighttime leg cramp. And finally, the silent but indispensable duo, folate and B12. They don't create a strong sensation or immediate effect, but they are the coordinators who help blood flow in the right direction, nerves function smoothly, and numbness gradually subsides after a few weeks. We don't see homocysteine levels drop, but we clearly feel that our steps are no longer shaky as before. Each vitamin isn't a standalone miracle cure, but when understood and used correctly, they become pocket-sized herbal tools, small supports that can greatly improve quality of life, especially for those over 60, when every step is no longer unconscious as it was in youth. If you remember, just a simple ankle rotation every morning, along with a niacin capsule or a glass of orange juice, can start a new day with awakened blood flow. A light breakfast with added vitamin C and E will make your entire circulatory system run more smoothly throughout the morning. And if you add folate and B12 after eating, it's a reminder that health doesn't come from anything grand, but from small, daily accumulations. Feel free to review each section if needed, noting down the dosages, timing, and usage methods shared, to turn them into habits as easy as brushing your teeth every morning. They won't just help warm your feet, but also bring peace of mind to your heart, knowing that you're taking care of yourself methodically, scientifically, and with great pride. Perhaps you once thought, at this age, poor circulation is normal. But in reality, that normal isn't mandatory, because the human body, even when it has passed the age of 60, 70, or more, always has the ability to recover if treated correctly and consistently every day. Feet that are less cold in the early morning, climbing a flight of stairs without getting breathless, or a night's sleep undisturbed by cramps. These may be very small changes, but for older adults, they are signs that your body is still listening and responding to what you do for it. Some people try niacin and chuckle at the strange flushing sensation like a sunrise in their chest. Others just need a glass of orange juice every morning to feel their legs much lighter. Some choose a healthy breakfast with eggs, avocado, and a vitamin E capsule, simple yet effective. And others just need to remember to take enough folate and B12 every morning to feel their hands less numb and feet less cold when driving at night. And you, where are you on this journey? Have you tried any of these vitamins yet? Is there any habit in today's video that you find easy to adopt right away? Or was there something you used to do wrong that you now understand? Share your story in the comments section below, because every experience is a quiet encouragement, not just for others, but also for yourself. And if you found this video helpful, don't hesitate to hit the like button or subscribe to the channel so we can meet again in future topics, continuing our journey together to keep our legs and our lives always strong. See you again, and don't forget, health isn't about age, but about small choices repeated every day.